Well, hi, this is Robert, and welcome to today's show. Now, it's Saturday morning, and I would typically be doing a Facebook Live, but I'm battling a pretty bad cold today, and I didn't know how well live would go over. But there's still a lot of information to be disseminated, and I thought I could go ahead and do this YouTube recording, which is not live, and get through it. And let's go ahead and start out with the case count. And of course, Johns Hopkins has this wonderful website up now, and we can see in the upper left-hand corner it's well over 11,000 cases. And I believe that number is still low because I think China put out updated numbers that puts it closer to 12,000 confirmed cases just in China alone. Anyway, so you can see what we're looking at. We're seeing a lot of the Asian countries are reporting in double digits now. Australia, Germany, Europe is seeing, since our last conversation, Europe has seen quite a few cases, with Germany reporting the most. And my understanding from the Bavarian Health Ministry is that these cases were all locally acquired cases too. So that's interesting point to be made with Germany. Here in the United States, we reported our 7th case on Friday in Santa Clara County in California, the 3rd case in California. And the U.S. also has a locally acquired case, as does several in Japan, at least one in Thailand, and Taiwan, and several other countries. So obviously, person-to-person transmission is a reality when it comes to the 2019 novel coronavirus. And as I said, there's been a lot of cases popping up in Europe over the past several days. We see Italy, the UK, Finland, Spain, and Sweden, all countries that have reported novel coronavirus cases in the past several days. And the total death count of these confirmed cases are all in China, and it's over 250 so far. And the vast majority of those are from Hubei province, the province which hosts the city of Wuhan. So those are some of the latest numbers. And I believe the China numbers are a little bit higher, but I could be wrong. Other big things that happened since the last time we spoke was that the World Health Organization's Emergency Committee met to look at the outbreak of novel coronavirus. And after you go through a lot of their chatter here in this article, we get to the meat of it. The committee agreed that the outbreak now meets the criteria for a public health emergency of international concern and proposed following advice to be issued as temporary recommendations. So I guess the World Health Organization saw that this thing is just going up in a very, very lateral way as far as cases. There's just thousands of cases being reported on a daily basis now. And there's no way they could not decide that this should be a public health emergency of international concern at this point, the way the trajectory for the cases is through today, February 1st. And it gives some advice for the World Health Organization, the importance of studying the possible source, right? We still don't know what the source is. Most believe it's an animal source, a mammal source, but we still do not know what the actual source is. And then it also gives some advice to China to continue to implement a comprehensive risk communication strategy that informs the population on the evolution of the outbreak, enhancing public health measures, ensure the resilience of the health system, and so on and so forth. So, yeah, something that everybody's kind of been waiting for did happen this past week in Geneva. Then in the United States, soon after, and the United States is not alone, several other countries have done this also. I've seen the Philippines has, I've seen Spain has, and some other countries. So Health and Human Services Secretary Alex Azar declared a public health emergency for the entire United States to aid the nation's healthcare community in responding to the 2019 novel coronavirus. And he says, while this virus poses a serious public health threat, the risk to the American public remains low at this time, and we are working to keep this risk low. We are committing to protecting the health and safety of all Americans. And this public health emergency declaration is the latest in a series of steps the Trump administration has taken to protect our country. Now, the emergency declaration gives state, tribal, and local health departments more flexibility to request that the HHS authorize them to temporarily reassign state, local, and tribal personnel to respond to the outbreak if their salaries normally are funded in whole or in part by the Public Health Service Act programs. And it goes on and on. And this comes very shortly after the Trump administration started a coronavirus task force, which I reported on the website outbreaknewstoday.com earlier in the week. The New York Times talks a little bit more about the public health emergency, and they say Friday's action exempts immediate family members of the American citizens and permanent residents. In addition, officials said any U.S. citizen returning home who has been in the Hubei province of China within the past 14 days will be quarantined for up to 14 days. And of course, Wuhan is the epicenter of the outbreak. Those who have been to other parts of China within the past 14 days will be subject to proactive entry screening and up to 14 days of monitoring and self-quarantine. The U.S. will also funnel all flights from China into I believe it's 7 airports, which include JFK, Chicago's O'Hare, and San Francisco International. So the travel restrictions are out. Now, not everybody in the public health world agree with travel bans, and there are a lot of disagreements on this course, and you can find those online with a very cursory Google search. But this is what's going on in the United States as of today. Then we also got this from the U.S. State Department on earlier this week. I think it was on Thursday. This China travel advisory, and it says, "Do not travel to China due to novel coronavirus, first identified in Wuhan, China." They talk about the public health emergency of international concern, and travelers should be prepared for travel restrictions to be put into effect with little or no advance notice. And that's where we're really at now. And again, a lot of airlines are suspending travel there. I see United, American, British Airways. A lot of major airlines are suspending travel to China. So that's always something to keep in mind. All right, let's talk about the transmission. I saw this wonderful chart on LinkedIn. And this little block here is the Wuhan virus. And going this way is basically the R0, how many people are infected. If one person is infected and there's a bunch of people that are able to become infected. So we see measles over here somewhere around 12 to 18 on the scale. They put them at 15, which is right in the middle. And then going up on the graph, it's how fatal are the diseases? And you can see like MERS, Ebola, bird flu, some of the others are way up there. So the Wuhan coronavirus has only got about a mortality rate of roughly 2 to 3%. And the number of transmissions are between 1.5 and 3.5. So I've seen 2 to 3 is kind of like ballpark for that. But it's very, very interesting. And you can see it's common cold is down here. Chickenpox, which is much more transmissible, is right here at around 8 or 9 on the R0 scale, basically. So I just thought that was an interesting chart to share with you. And then I saw this article. I believe that's in Science Alert. And it's comparing the new coronavirus with other zoonotic outbreaks in a simple chart, they say. They say the outbreak isn't currently considered a pandemic, however, despite its rapid spread. And they talk about the public health emergency. and the quarantines. And here's the chart, which is kind of neat. And they looked at major viral outbreaks over the past 50 years. And you can see that Wuhan's right down here at the bottom, over 8,000 cases, which is already leapfrogged SARS. However, we got a fatality rate of about 2%. And it's been seen in 20 or so countries. And you can really compare that to some of these outbreaks of Ebola, H1N1 about a decade ago, and some others. So it clearly has the lowest fatality rate of all those. I mean, a lot of these are very, very high, right? Marburg is 80%, and H5N1 bird flu over 50%. Nipah, which we've talked about on the website, outbreaknewstoday.com, currently hovering around 80%. So a lot of serious zoonotic outbreaks in the past 5 decades. And to date, it looks like Wuhan has been the least fatal. So we keep an eye on that, though, because things can change. And there's a lot we still don't know. And the last thing I want to talk about is this paper in the New England Journal of Medicine, and it talks about the first 2019 novel coronavirus case in the U.S. And that of course, was earlier in January in a patient in Washington State. And it was a 35-year-old man who presented at an urgent care clinic in Snohomish County, Washington. He had just returned to Washington State on January 15th after visiting family in Wuhan. Anyway, what we can see in this paper is all the different symptomology and testing that was performed on this gentleman. And I'll just go to the conclusion to talk about the diagnostics. It says here, the initial respiratory specimens, both nasopharyngeal and oropharyngeal, obtained from this patient on day 4 of illness were positive for the 2019 novel coronavirus. Both upper respiratory specimens obtained on illness day 7 remain positive, including persistent high levels in the nasopharyngeal swab specimen. Stool obtained on illness day 7 was also positive for 2019 novel coronavirus. Serum specimens for both collection days were negative. Nasopharyngeal and oropharyngeal specimens obtained on illness days 11 and 12 showed a trend toward decreasing levels of virus. The oropharyngeal specimen tested negative on day 12, and PCR results for serum obtained on these dates are still pending. So they just talk about it, and they're saying detection of 2019 novel coronavirus RNA in specimens from the upper respiratory tract with a low CT value on days 4 and 7 of illness is suggestive of high viral loads and potential for transmissibility. It is notable that we detected novel coronavirus RNA in a stool specimen collected at day 7 of the patient's illness. Although serum specimens from our case patient were repeatedly negative, viral RNA has been detected in blood in severely ill patients in China. However, extrapulmonary detection of viral RNA does not necessarily mean that infectious virus is present. And the clinical significance of this detection of viral RNA outside the respiratory tract is still unknown at this time, because this was kind of the thing that piqued people's attention when this paper came out, was the fact that the viral RNA was found in the stool specimen. But as the authors note, it does not necessarily mean that infectious virus is present, and they don't know what the clinical significance of any viral RNA outside of the respiratory tract, what it means, right? They just don't know. So I just thought that would be interesting to just point out to you, and I encourage you to check that out. That's at the New England Journal of Medicine. Okay, I'm losing my voice, so I want to go ahead and close now. And I want to thank you for watching. Please share this video with your friends and subscribe to the channel. I want to encourage you to just keep on coming back. I'm going to keep on doing these kind of shows, not only on novel coronavirus, but all kinds of infectious disease issues, including interviews with experts. And I try to do Facebook Lives periodically, particularly on a Saturday, but not today. But I want to encourage you to subscribe or like or whatever, follow the Facebook page. That's at Infectious Disease News on Facebook. And there's a link down below where you can click to it and get to it quite rapidly. So again, thanks for watching, and I'll see you on the next Outbreak News TV.